Welcome to today's explainer. If you're tuning in right now, chances are you or someone you really love has been searching for answers, probably for a very long time. I want you to know right off the bat that you've finally found a safe, completely validating space. Today, we're going to unpack the true reality of endometriosis. We're looking at the hard science, the facts, and most importantly, the actionable steps you can actually take to reclaim your life. Because your pain is real, your experiences are valid, and you absolutely deserve to understand what is happening inside your own body.
Okay, let's just quickly look at our roadmap for today. We're covering 1. The reality of endometriosis. 2. Understanding the root causes. 3. Navigating fertility and pregnancy. 4. Medical treatment options. 5. Anti-inflammatory nutrition and supplements. And 6. Advocating for your care.
Section 1. The reality of endometriosis, validating your pain and experience.
Did you know endometriosis affects 1 in 10 women of reproductive age? That's roughly 190 million women worldwide. To put that into perspective, it's literally as common as diabetes. And yet, the average time a woman has to wait before finally getting an endometriosis diagnosis is a staggering 7 to 10 years. I really want to be clear about something right now. That heartbreaking delay, it's not because the disease is invisible or just too tricky to figure out. It happens because women's pain has historically been completely dismissed. We've basically been conditioned to believe that severe, life-altering pain is just, part of being a woman.
And that brings us to a question that carries such a heavy emotional toll for so many of us. Why did it take so long to diagnose me? For generations, period pain has been unfairly normalized. Women are constantly told they're just having bad cramps, or even worse, that they're just being dramatic. Plus, the most common form of endometriosis, which involves superficial lesions on the pelvic lining, is completely invisible on your standard ultrasounds and MRIs. So you get a scan, it comes back quote-unquote normal, and you're sent home feeling like you're losing your mind. Even though the reality is, the only definitive way to diagnose it is through keyhole surgery. There's also this really profound disconnect between the clinical staging of the disease and a woman's actual lived experience. Doctors use a staging system, right? From stage 1, which is considered mild, to stage 4, which is severe. But here's the thing. A stage 1 diagnosis can cause absolutely debilitating, keep you in bed all day symptoms. Meanwhile, someone with stage 4 might only feel relatively mild discomfort. So if your chart says stage 1, but you literally can't get out of bed, please hear me. Your pain is real, it's valid, and it absolutely deserves comprehensive care. Section 2. Understanding the root causes, the science behind the symptoms.
So why does this actually happen? Well, while we still don't know the whole story, the leading scientific theory is something called retrograde menstruation. This is when, during your period, some blood actually flows backward. It goes through the fallopian tubes and spills out into the pelvic cavity, carrying stray endometrial cells along with it. But here's the real catch. This backward flow, it actually happens in 70 to 90% of women, yet only about 10% go on to develop endometriosis. Clearly, retrograde menstruation isn't the whole puzzle. So let's look at how this biological cascade actually turns into the disease. Step 1, as we mentioned, the blood flows backward. Step 2 is where the dysfunction really kicks in. The immune system fails to clear out those stray cells. In a totally healthy body, immune cells would just sweep in and destroy them. But with endometriosis, that surveillance system just breaks down. Then, step 3, those cells implant themselves. They actually start producing their own estrogen to fuel their growth, and they bleed every single month, but with nowhere for that blood to go. This pooled blood releases iron, which creates intense oxidative stress. You can kind of think of it like cellular rust. It damages all the surrounding tissues and causes massive, severe inflammation. Now let's quickly clear up a really common point of confusion between two conditions that sound similar and honestly often show up together: endometriosis and adenomyosis. Basically, while endometriosis is tissue growing outside the uterus, adenomyosis is tissue growing deep into the actual muscle wall of the uterus itself. They overlap in about 20 to 50% of cases. So if you're dealing with particularly heavy periods, severe cramping, and a tender, noticeably enlarged uterus, adenomyosis might actually be the culprit. Section 3. Navigating fertility and pregnancy. Facts to ease your anxiety. Okay, we absolutely have to dismantle a really harmful, deeply ingrained form of medical gaslighting right now. No woman should ever be told to just get pregnant as a treatment for endometriosis. Yes, pregnancy stops your period and temporarily shifts your hormonal balance, which might briefly mask your symptoms, but the lesions, they don't just magically disappear. The symptoms almost always come rushing back after the baby is born. You should never be advised to use a massive life decision, like bringing a child into the world, as a quick fix medical treatment plan. But how exactly does endometriosis impact fertility? Well, there are some very real specific biological hurdles here. Scarring and adhesions can physically block the fallopian tubes so the egg can't travel. Then there's what doctors call chocolate cysts. These are cysts on the ovaries filled with old, dark blood, and they damage the surrounding egg-producing tissue. And remember that cellular oxidative stress, that rust we talked about? It actively damages egg quality. Plus, immune and hormonal shifts make the uterine lining a lot less receptive to implantation. It creates this really brutal trade-off for patients, too. Surgically removing those cysts can definitely reduce your pain, but cutting them out often removes some healthy ovarian tissue along with it, which can further lower your egg reserves.
Section 4. Medical treatment options. What modern medicine can and can't do.
Let's just be completely real for a second. Currently, there is no cure for this disease, only symptom management. So let's run through the standard hormonal options you'll usually be offered. You've got the combined pill, which suppresses ovulation, all the way up to GnRH agonists, which actually throw your body into a temporary menopause. Basically, these treatments work by starving the disease of estrogen. And look, they can be incredibly effective for managing your day-to-day symptoms, but they absolutely have their limits. Obviously, they're not going to work if you're actively trying to conceive. But more importantly, they completely ignore the underlying immune dysfunction and the inflammation that's actually driving the disease. They suppress the symptoms, sure, but they don't treat the root cause. When it comes to surgery, there is a massive difference in techniques, and you really need to know about this before you go under. Excision surgery involves a surgeon carefully cutting out the lesions completely. We're talking root and all. Ablation, on the other hand, just burns the surface of the lesions. Excision is widely considered the gold standard because it offers much better long-term results. But we've got to be honest here. Even surgery isn't a permanent, perfect fix. Even with expert top-tier excision, the disease still returns in about 20 to 40% of women within 5 years.
Section 5. Anti-inflammatory nutrition and supplements. Taking control of your daily health.
Since surgery isn't a magical permanent fix, what you do in your everyday life matters so much. By adopting anti-inflammatory eating habits, you can actively manage those symptoms and promote hormone balance all day long. Let's build a daily nutrition schedule, right? Start your morning strong by avoiding highly processed breakfast foods and refined seed oils. When lunch rolls around, focus on big servings of broccoli, cauliflower, and leafy greens. These are amazing because they contain compounds that literally help your body safely process excess estrogen. Then, for dinner, prioritize oily fish and high-fiber foods. Fiber is crucial because it supports your estrobolome. That's a specific community of gut bacteria that act like a cleanup crew, eliminating excess estrogen so it can't feed your lesions. And finally, in the evening, try to limit alcohol. Even moderate drinking measurably spikes your estrogen levels.
Now, to really support your gut and immune health, targeted supplements are an absolute game changer. Remember, the pelvic cavity of someone with endo is swimming in oxidative stress. Supplements like NAC are just incredible for this. Clinical trials actually show it can shrink endometriomas. The standard is usually 600 milligrams 3 times a day. When you pair NAC with high doses of omega-3s to target pelvic inflammation and vitamin D3 to help calm down that overactive immune system, you are directly fighting off that cellular rust we talked about earlier. Add in some magnesium, which is fantastic for relaxing the uterus and easing those awful cramps, and finish the day with melatonin, which works as a really potent antioxidant while you're getting some much-needed sleep.
Section 6. Advocating for your care. Empowering your doctor visits.
I need you to hear this loud and clear. Never, ever let anyone tell you to just push through debilitating pain. It is time to seek out an actual endometriosis specialist if you're experiencing any of these major signs. If your period pain stops you from living your normal daily life, or if you're dealing with pain during sex or painful bowel movements, if you're experiencing this heavy, extreme fatigue that noticeably flares up with your cycle, those are massive red flags. And most importantly, if you have raised these exact symptoms before and a doctor just brushed you off, do not give up. It is absolutely time for a second opinion.
I highly recommend grabbing a screenshot of this right now or writing these down. You need to bring these exact questions to your next gynecologist appointment. Look them in the eye and ask directly. Have you checked for deep infiltrating disease or adenomyosis? Are you planning to use excision or ablation surgery? What is my ovarian reserve? By asking these really specific, highly informed questions, you instantly change the entire dynamic in that exam room. You're no longer just a passive patient. You're positioning yourself as an educated, fierce advocate for your own body, making sure absolutely nothing gets missed.
Which leaves us with this final, vital question to think about. Are you ready to take back control of your health journey and finally demand the comprehensive care you actually deserve? Look, endometriosis is a really daunting, incredibly complex disease, but you do not have to be a passive passenger on this ride. Your pain is real, your voice matters, and now you're armed with the facts, the hard science, and the actionable steps to go out there and demand the care you so richly deserve. Thank you so much for joining me for this explainer, and please take really good care of yourselves out there.